Knock, knock. Hi, my name is Sam. I'm going to be your student nurse today. I'm going to be doing a heart and lung assessment on you. Can you tell me your name and date of birth?
Katie Wyman, 11/21/96.
And can you tell me where you're located?
At the doctor's office.
Okay. And can you tell me who the President of the U.S. is?
Donald Trump.
Donald Trump. Okay. And so as I'm looking at my patient, I noticed that she is appropriately dressed to weather. She has good hygiene. I don't smell any odors. Her breathing is effortless. She is alert and oriented times 3. And so I'm going to go ahead and I'm going to start my heart assessment on her. As I come over, I notice that her temperature is bilaterally equal and warm. I don't see any edema on either side. I'm going to look at her jugular venous distension. I'm going to have her tilt. I notice that there's no elevation. I'm going to go ahead and listen to her carotid pulse. And I don't hear any sounds. I'm going to feel her pulses real quick. I'm going to feel for the carotid. They're bilaterally equal. Brachial, I feel that. Radial, I feel it. I would feel her femoral pulse, which would be on the inside of her groin. And I would feel for the popliteal, that would be on the back side of her knee. Dorsalis pedis. And then I would feel her posterior tibia. And they're bilaterally equal, and they're symmetrical. Now I'm going to go ahead and listen to her heart. I'm going to go ahead and go to the aortic area, pulmonic area, Erb's point, mitral, or tricuspid, and now mitral. I hear both S1 and S2 with no extra hard sounds or murmurs. I'm going to go ahead and ask you a couple questions real quick. Do you have any family history of diabetes?
Nope.
Are you experiencing any chest pain?
Nope.
And do you drink alcohol?
No.
Okay. That's it for the heart assessment. I'm going to go ahead and I'm going to move on to the lungs. I noticed that her breathing is effortless, and I'm going to feel her trachea to make sure it's midline. It's midline and it's slightly movable. I'm going to go ahead and feel for chest extensions in the back side. I'm going to put it right here. Can you take a big breath for me? Okay, and it fully expands. And I'm going to go ahead and I'm going to start listening on the back. I'm going to make sure I'm in between the scapulas. Can you take a big breath for me? Big breath. Big breath. Big breath. Big breath. Big breath. Big breath. And big breath. Okay, and I'm going to feel right here on the side, laterally. Big breath. On the other side. Big breath. Now I'm going to have you turn to the front real quick. Big breath. Big breath. Big breath. Big breath. Big breath. And big breath. Okay. Lung sounds seem to be unlabored, normal, and effortless. And I'm going to ask you a couple more questions. Do you have any history of asthma?
No.
Do you have any family history of lung cancer?
No.
Are you experiencing any difficulty breathing?
Nope.
Okay, and that's it for my assessment. Okay. Now I'm going to go ahead and I'm going to do my assessment on this patient. The patient complains of shortness of breath, respiratory rate of 30, which is increased, slightly labored, lung sounds diminished in the left lower lobe, which is, since it's diminished sounds, it could be that there's fluid or air in the lungs possibly, which could be a sign maybe of pneumonia. She has productive cough with green sputum, O2 saturation 95. She does have a temperature of 102.1, which is a fever. Heart rate is 98, which is within normal limits, but it is slightly on the higher end. And the blood pressure is 148/84, which is elevated. Her lab results, she does have increased white blood count, normal red blood count, platelets are within normal limits, glucose is okay. Her TSH is elevated. So I think we would get a chest x-ray ordered. It's the least invasive and it can just give us a bigger picture of what's going on. The sputum cytology ordered, I wouldn't do that just because it's more useful when we're looking at someone that possibly has lung cancer. So depending on what the chest x-ray says, maybe we could do that. And then also I just want to do the lung VQ scan. So that's it for that.